All right. Hello, everyone. My name is Rebecca Taylor Shaw, and I'm the owner of Charleston Hypnosis Center and the American Hypnosis and Coaching Academy. And I am really happy that you are attending this presentation today, not only to potentially help yourself, but to also potentially help other people. And it's a big topic. The more I started working on the content for this topic, I just kept adding more and more content because trauma is such a broad term and it can affect people in so many different ways on so many different levels. So what I'm hoping to do today is give you as much information as I can in an hour. And then beyond that, if you have any questions, I'll show you how you can contact me, or maybe it will just inspire you to continue with some additional information and resources so that you can help other people and help yourself with this topic. And so I am going to use a slide share today in order to do that. So I'm going to start that now. And if you have any questions as we're going along, I really love questions. I love to have something interactive because, again, I know I can't cover everything. So if something I've said as going through this presentation sparks a question for you and you're willing to share it in the chat, you can drop it into the chat box in this, and then at the end, I'll go through those questions. If it's a question that you want to ask me privately, there'll be some information at the end how you could do that. And I'm open and welcoming those questions as well, because for some people, your trauma might be not something that you want to discuss with other people. And I completely understand and respect that. So we have lots of ways to continue this conversation and your exploration of this when we're finished here today. So we'll go ahead and get started. Also, you can speak, but you can also just drop a question in the chat, but there is a raise hand feature in this webinar, which I really like. Okay, so we're going to talk about healing from trauma today, and healing yourself, healing others. And I call this a journey to recovery, because for many people, when we're dealing with trauma, it is not just a one-off session or a one-off therapy session or anything like that. It is a process, it is a journey, and it doesn't have to be a long one, but it isn't just like flipping a switch. Okay. So a little bit about me. My name's Rebecca Taylor Shaw, and like I said, I own Charleston Hypnosis Center. I'm the owner of the American Hypnosis and Coaching Academy. So I've been teaching clinical hypnosis and coaching methods for about 10 years, and that is me. Okay, so trauma in itself is, like I said, a big topic. And so I'm hoping that this presentation today will give you insights, a few strategies for coping, some strategies you can use with other people in the immediate aftermath of something traumatic, and also down the line. Because trauma can hang with people for decades, years. That was probably one of the first things I discovered when I got into my own journey with hypnotherapy in my 20s. And then what I just discovered for other people. You know, the funny thing is I didn't go into hypnosis as a practice with the idea of healing people's traumas. I went in with this mindset that it was going to be all about personal development and helping people break habits and improve their mindset and, you know, feel better. But what I quickly discovered within the first year or so is that oftentimes our sort of mundane, top of mind, annoying things about ourselves that we want to change, but we can't change, oftentimes go back to something that was traumatic earlier in life, even if those things seem years ago, or even if those things seem like, something a child might feel is traumatic, but you as an adult would not consider that thing upsetting. And we're going to talk a little bit about how the subconscious mind plays a role in that, how it plays a role in healing, and again, some practical tips. Okay, so what is trauma exactly? The definition of trauma says it refers to a deeply distressing event or events that exceed an individual's normal coping abilities. And that, again, is something why trauma can be subjective. It can be something typically that's sudden, unexpected, occurring without warning or preparation. However, if you all have been watching the news at any level in the past year, oftentimes some of these traumas do come with warning. When I used to live in California, an earthquake could come without warning. And that was very nerve-wracking to have your little, have my, bug out bag in my condo. But we do have warning sometimes of the fires, or most people did have some warning. Hurricane, we did have some warning, although sometimes, as we found out with North Carolina and Hurricane Helene, sometimes things occur in places and in ways that we are not expecting. So a traumatic event involves real or perceived danger to an individual's physical or emotional well-being. So perceived danger, again, something that may or may not happen, something that could happen. So trauma can also result from experiences involving physical, sexual abuse, emotional abuse, verbal abuse. It goes on and on when it really comes to the sources, but we will be talking about that today. A situation may or may not register as trauma for you versus someone sitting right next to you. The reactions to events differ as greatly as the sources of trauma themselves. And what I mean by that is you can put two people in the same situation. One might experience trauma and the other is happy. And I'll give you an example. Many years ago, I went with my family for a spring break down to Florida, and we wanted to swim with the manatees at Crystal River. And we booked our excursion, and we did that, and we're in the water. First thing in the morning, it's quiet, it's foggy, and we had been swimming around with the manatees for a little bit, and we were at the end, and one of the manatees literally swam up under me and went straight up and launched me up out of the water. And I flew off the manatee. When you're kids in the pools and your parents would shoot you up out of the water, it was exactly like that. And the captain was worried about, his instant reaction was to be worried about me. But when I finally came up out of the water, I was laughing my butt off about it. Now, someone else might have been extremely traumatized by that experience. So again, you can put two people in the ocean. One's extremely happy, one is afraid of sharks. So there's, it's really a big piece of it is your interpretation. But with that said, there are many things where pretty much everyone would be traumatized if they went through that. But I want to say that because when I do clinical hypnotherapy with people, oftentimes the memories that people track their problem back to are not things that somebody else might find traumatic, like getting pushed out of the car the first day of kindergarten into the rain, and my client was traumatized by that at age 5, whereas another kid might have been like, see you, Mom, have a great day, right? So it's very subjective, and I really want to make that point. Okay, sources of trauma. So we're going to go into the different categories. Of course, what I just mentioned, natural disasters, wildfires, hurricanes, earthquakes, flooding are obvious ones that can cause trauma for people if they've actually lived through one or just the scare of one. So I know here in the South Carolina, Charleston area, we're at the coast, and every single year we're kind of bracing for, will we have a hurricane that comes here? Will it be a direct hit? Will we have to evacuate? And it's nerve-wracking, and I'm not going to say that that creates trauma for everyone, but when the governor comes on the news and takes over the networks and tells everyone that it's a mandatory evacuation, it can cause trauma for people. And the same with these wildfires. I actually had one client who lost her home, and I had another client who was told to evacuate for the fires. Their home was in that a mandatory evacuation area. And luckily, with the second person, they didn't have their house burned down, but the threat of it and the looting that was going on, he, and I'm sure many people in his neighborhood and community are also dealing with trauma, even though they weren't directly impacted by the fires. So that's something to consider is, if it's a near miss, a scare, and you're going through that or have gone through that, you may be thinking to yourself, rationalizing that you shouldn't have some effects by it, but you may have effects by it. If you were affected by one before and there's a threat of another one, it could re-stimulate old fears, unhealed trauma from the past. So a big part of this presentation today is just kind of exploring and kind of getting you aware of there may be things lurking within yourself or other people that you care about that are really influencing them at the subconscious level or even conscious level that may need some work to feel better and not be so reactive to it or impacted by it. So another area of trauma is witnessing. So exposure to violence, seeing a crime, seeing, violence in the home, domestic abuse can be very, very traumatic for children and long lasting. Emotional distress, seeing someone in emotional distress, a child seeing a parent in extreme emotional distress, and it can really have long-term effects on you and others. Again, just kind of, if this hasn't been something, some of you might be like, yep, you're not telling me anything I don't already know. And I know that everyone listening to this now and on the replay is in a different place. So it's worth mentioning. Okay, so here's something else a lot of people aren't familiar with, and it's called Adverse Childhood Experiences, or ACEs. And if you have not heard about this, but you feel like you had some trauma growing up, some things that felt traumatic to you, even if your adult self says it wouldn't be traumatic or shouldn't be traumatic, but if it felt traumatic to you as a child, there's actually a quiz you can take. If you go into any search engine and you search for Adverse Childhood Experiences or the ACEs quiz, there's some different websites out there, but ACEs they refer to potentially traumatic events, or I would say traumatic events that occurred during childhood and typically between the ages of 0 and 17. And they can significantly impact your emotional state, your resilience, your ability to focus, your well-being. And so again, it could be physical abuse, domestic violence, it could be sexual abuse, it could be witnessing any of those things. It could be a parent dying. could be a pet dying. But the impacts is what they've studied. And this is where it gets really interesting. And I'll just synthesize it here. But what they've said is that they can predict now health issues, especially heart conditions. And the more of these quote unquote ACEs you have, so you go through this quiz and it has a checklist and you can say, yes, I experienced that. No, I didn't experience that. And it's long and it's very thorough. And the more of those you can check off, the more they are now correlating these background issues, these adverse childhood experiences to chronic health conditions, again, heart conditions, etc. And so all the more reason in my mind to have ways to address those things, or potentially, even though you think you might not need to address them, they could be contributing to, believe it or not, current life disease and health conditions. And so again, this talk today, we could do a whole presentation on this alone, but I just wanted to bring it to your awareness. And if it's something that resonates with you, listen to your intuition today. And if anything I'm saying sort of sparks something, give it a more in-depth look. So trauma from accidents, car accidents. I had a client a couple of years ago, that had a phobia of driving on freeways. And it was because of a near car crash where she was driving and she fell asleep at the wheel, and she was able to wake up and correct and, at the last minute, avoid an accident. But many people see accidents on the road. There could be an industrial accident. So somewhere at work, a workplace accident. I worked with a colleague years ago who owns the Chicago Stress Relief Center, and Dr. Weissman, and he specialized in using hypnotherapy to help people with workplace trauma. And he, at the time when we were speaking, he was working with a group of Home Depot employees that had been witness to an armed robbery in the store. And so you're thinking, okay, that didn't happen to me. No one died. Nonetheless, it can cause an after effect for anxiety, etc. We'll go over, what those symptoms are. But surgery is another thing that can feel like trauma to the body. And this is a really interesting one, because I frequently do sessions, one-off hypnosis sessions, for people who are going to have hip replacement, knee replacement, plastic surgery, reconstructive surgery, because the body perceives that process as invasive. It doesn't necessarily know. Your conscious mind knows that you need this surgery or you want this surgery, but the body just wakes up from the surgery and says, what the heck just happened? I got hit by a bus, So it's amazing. This is one of the most interesting things about hypnosis, and it's a very obscure thing, but if you can message the subconscious mind and let the body know that what's about to happen is a welcome procedure, helpful, useful, healing, etc. You will tip, and I usually put in suggestions that the healing will be twice as fast, it'll be rapid, it'll be efficient, etc. People have told me for years that their recovery time and their recovery experience is so much better. And even the doctors will oftentimes say, wow, you recovered amazingly. You're my poster patient for this type of surgery, etc. So just letting the body know, having a way to message the subconscious mind that a surgery is welcome and that it's necessary can be really powerful. Then, of course, we definitely would want to pause on the loss of a loved one, a loss of a friend, a family member, even a coworker that you're close with, and certainly pets can be very devastating for people and cause trauma. Elizabeth Kubler-Ross wrote a book with David Kessler, and it was called On Grief and Grieving years ago. And it says, I will grieve forever. You will grieve forever, ever. You will not get over the loss of a loved one. You'll learn to live with it. You will heal and you will rebuild yourself around the loss you have suffered. You will be whole again, but you will never be the same, nor should you be the same, nor would you want to. And so there is, the 5 stages of grief, and yet on the backdrop of that is trauma. And I've seen, and something I'd like to point out to you guys, whether it's you've gone through this yourself or you've seen someone go through this. I remember when I was about 21, my grandfather passed away, and we went to the funeral, and it was an open casket. He passed away from prostate cancer. It was a very long, drawn out thing. It wasn't sudden. But I'll never forget my father, who was probably in his early 40s at the time, was standing by the casket, and he kept saying, doesn't he look great? Doesn't he look so good? And in my mind, I'm just thinking, this is bizarre. Why would you be saying that, Dad? He's passed, But now, knowing what I know about trauma and shock, and, even if it's something is expected, it can still really impact people and affect their cognitive processing, their moods. It can behave in ways that seem out of ordinary for their personality. And that's a big sign of somebody who's going through trauma and loss, especially loss of a loved one, is they might be out of the ordinary angry, having angry outbursts. And those angry outbursts may last for a short amount of time. They may go on for years. Some of that might have to do with, if the anger is just them trying to process the grief, or if it was a protective mechanism as a child or as a young adult. But I can tell you personally, I had the most strange to me experience when my beagle passed away last year, last March. He was 14, old, expected to pass. That's about the time they go. And he seemed fine at Christmas. And then my son called me one day and he said, Mom, you got to come up here. I think Cody's going to pass away. Cody's the beagle. And he said, I can't have him die on my watch, because my son's cat had just passed away about 2 months before that in a very tragic way. He just pulled her out from under the bed and she had blood in her mouth. And, when you have anybody who has a pet can relate to what I'm saying. It is traumatic. So I go up there, I take the dog up to the vet, because I'm just wondering if they can give him some medication. Anyway, he ends up passing away in the vet, and all of a sudden he's, going flatlining, and there he goes. And I knew it was coming. He was old, my logical, rational mind does all that. But this is the strangest thing, guys. For the next week, I kept leaving my purse in places. Like, I was having these just brain farts majorly. I mean, I've been in my office building for 18 years. We have a shared bathroom downstairs, and I left my purse in the bathroom. Never done that in 18 years. And I'm driving home, and one of the other ladies in the building calls me up and says, hey, someone left their purse there. And I look over, my purse isn't there. And I did that somewhere else too. And it was just, it could be, what I'm telling you is, it could be just something very mundane like that you're just having these gaps of lapses of memory or something. And that's the shock. And so luckily I knew what it was. I knew why it had happened. And, I just was kind to myself about it and waited to see if I kind of processed it and, if I was going to need to do something else. And for me, maybe because of this work that I do in my awareness, I was just able to acknowledge it and it passed, thankfully. Okay, so near death or loss experiences. So it might not be that you actually lost someone or that you died, obviously, but if you had a near-death experience. My son had a near-death car accident. He severed 2 cranial arteries and almost died. And probably for about a few months, he had just these weird bouts of inexplicable anger popping off at the chiropractor and people, and luckily she understood grief and the near-death thing, or the grief of, he lost his vehicle, but also just what happens to the brain. So if you have a head injury as well, that's another layer to it. But point being that even survivor trauma, surviving something, the close call can be extremely traumatic. A lot of 9/11 survivors who were supposed to be there that day, the close call, have had to deal with a lot of trauma. Okay, so what are the symptoms of shock? So I would say shock is that immediate thing. Like I said, for me, the shock was creating some just short-term little memory lapses, but it could be feelings of numbness, disbelief, certainly difficulty concentrating and making decisions. And that is, the fight or flight brain. So when someone has a shock, the body goes into fight or flight. And the fight or flight brain is the scanning brain. And this is something I really want to pause on, and I will as we go throughout. But there is a huge correlation between a lack of concentration and trauma. And some people will even come to believe, if it goes on long enough, that they have ADD or ADHD, where there is this phenomenon called phantom ADD or phantom ADHD. I was actually involved in a project where I was interviewed for a project called The Truth About ADHD. And this is what I spoke about. This is in my wheelhouse. I've actually tracked back people's ADD and ADHD to a traumatic event. Now, I'm not saying that everyone who has ADD or ADHD will track it back to a traumatic event, but many people do. I had a client who had agoraphobia, afraid to go outside. He had just basically cloistered himself. And he also said that he was wanting to get off his ADD, ADHD medicine. And sure enough, they both tracked back to, he had been witness to one of the shootings that happened out in the public. I think it was in Virginia or Maryland. And then that tracked back to being a little boy, and his mom would worked at night, and he would stay home with his little brother. He was 6, his brother was 4, and it was scary for him. So basically, that brain goes into fight or flight to watch, to be aware, to protect, and then basically never reset itself as a little boy. And then it just, I guess, kind of proceeded along, but then it flared up when he had this recent witnessing of a crime. And so that's a big thing that I think would be probably one of the most universal symptoms that people don't know about or don't talk about. Maybe physicians don't talk about, but I have 100% seen in my clinical practice in hypnotherapy that that's a persisting effect. is that inability to focus. And basically what happens is it's like your brain goes into fight or flight. I need to run, fight, or freeze. And that's the scanning mind, the scanning brain, looking for danger. How am I going to get out of this? And then basically once the upsetting or traumatic event is over, the brain doesn't reset itself. It never goes off of that scanning. It stays in low level scanning for potentially years. Good news about that is that if that's what it is for you or someone you know, you can significantly, I believe, improve the symptoms of ADD and ADHD if that's the root cause. Okay, so on to other symptoms of shock. Irritability, like my son having the anger, emotional outbursts, crying easily, just for no reason, meaning like the event is over, you're driving and you're crying, you're cutting vegetables in the kitchen and you're crying. Flashbacks is another. That's a really stressful one, to have these flashbacks, and that's the subconscious mind trying to process the event and what happened. So you might have intrusive thoughts, flashbacks, certainly sleep disturbances, and basically what happens with that, and that can persist on to what we'll say here is the not just in the shock, but also into PTSD. But we'll talk about the sleep disturbances a little bit more as we go along. So if you or someone else seems to be repeatedly overreacting to a situation, meaning their response to a situation seems to be maybe in rational terms, excessively sensitive or excessively upset about or anxious about something. It's not always, because that person could just be a highly sensitive person, but it could also be a sign that there's some unhealed trauma. And so whenever someone, let me just say this, when someone comes to my office for clinical hypnosis and they tell me that they feel themselves that they overreact, and how they overreact could be they are quick knee-jerk anger. They feel extremely anxious, for example, just not hearing back from people with a phone call or a text. Like these things that are just like your everyday life things where you think, gosh, I'm just overreacting, or you have this knee-jerk hair trigger response to something. It could be that that's pointing you to some trauma that's still imprinted, hardwired in your brain, that's creating an after effect. Okay, so phobias. Phobias are typically, if you have a phobia, that can be a sign of trauma that didn't get processed correctly. It's a well-intended behavior from the subconscious point of view. So for example, the woman who had the phobia of driving, and she had the near, probably almost severely injured or death accident by falling asleep at the car. And then afterwards, her mind says, we're not driving, we're not getting on the freeway. I had a little boy in my office a few months ago who had a phobia to dogs, and it tracked back to a scary experience with the big dog when he was 2 or 3 years old. So the subconscious has a good intention. If there's this rush of adrenaline, if the body says, this situation is unsafe, it can oftentimes basically sear into your brain a pattern of steering away from something. And the way to get you to steer away from it is to make you phobic of it. So it can go back to traumatic events from childhood. It can go back to, any time really. I've had people who have phobias of driving over bridges, for example, and it tracks back to Nothing bad that happened on the bridge per se with the car or the bridge, but in 2 cases, they were on the phone and happened to have extremely upsetting conversations. One was told she was fired from her job or let go. The other was having an extremely heated conversation with her soon-to-be ex-husband. And so what happens in those situations is the mind starts looking around for what's causing this intense reaction, adrenaline flow, fight or flight. And then it basically says, oh, we're on a bridge. It must be the bridge. So it's well intended, but misdirected. So that's the kind of thing that can happen. And again, a stressful conversation on a bridge was, in both of those instances, traumatic to those 2 women. Somebody else might be able to have that conversation and it just, they deal with it and go on. Riding a roller coaster. I don't know how many people would say, you go on roller coasters to have fun, but many people will say they had a traumatic, scary experience on a roller coaster or skiing down a hill. And then after that, they weren't going to do any more fun parks or skiing. So it can be that. It can also be a learned response. So, and that would be more of, maybe getting yelled at for something over and over again that you then don't do it. So, okay. Insomnia can also be a sign of unhealed trauma. So if you or someone has really struggled with sleep, it could be falling asleep. It could be staying asleep. Now, not all insomnia has to do with trauma. Sometimes it's just somebody with a very type A brain, go-getter, gotta get everything done. So it could be that kind of person where they just need to learn how to calm the mind and shut the brain off at night. It could be somebody that worries a lot. It could be somebody that ruminates a lot. So with those things said, it can also be, for a subset of people who have insomnia or sleep disturbances, it can be that it ties back to something related to death. So I had one woman and she had a near-death experience when she was a little girl. She had a really bad pneumonia, fever, almost died, and we tracked it back to the doctor telling her parents while she was in the room, she was a little girl in grade, like probably 2nd or 3rd grade, saying, this doesn't look good. She could die. And she heard that and didn't want to go to sleep. And so what happens too, so just so you know, these things don't always persist your whole life. They can go into a sort of latent place in your brain, and then something reactivates it later on in life. And what could reactivate it would be something that feels the same emotionally or feels the same physically. I had someone who had insomnia and it tracked back to his little brother tragically drowning. And then he was next door at the neighbor's swimming pool. And the belief he took on as a little boy is that they were being loud in the pool, and that if they hadn't been so loud, he would have heard his brother. So his little 6-year-old self rolled that all into a belief that it's not okay to be in chaos. It's not okay to be around loud noises. And then he moved somewhere where there were crows at night or outside the home. And that sparked his insomnia. It was re-triggering back to that childhood memory of his brother tragically passing away that the family never got any help for. So again, I'm just trying to share all these different things that may make you aware. And obviously a lot of them won't relate to you, but gosh, it could be a gift to somebody you know. If something I've said today doesn't directly relate to you, Also, if you are a therapist or if you are a coach or a clinical hypnotherapist, knowing these types of root causes and relational ideas could really help you with where you take the work. Or you might decide to directly work with people for trauma or something like that. Sexual dysfunction can often be rooted in trauma. And what I've seen interestingly with women is that sometimes that trauma won't come forward to cause the dysfunction until childbirth. Something about the extreme pain of childbirth will then cause, several times I've seen this, cause a woman to all of a sudden have trouble with intimacy, having trouble with achieving orgasm, pain during intercourse, things like that. Vaginal pain during intercourse can frequently track back to childhood abuse or molestation or something like that. And that's a very delicate topic, but definitely worth mentioning, because if it is a problem, it's not something you just have to suffer through. And that would be something to have a private conversation about. And definitely either work with doing hypnotherapy or probably also psychotherapy, but there are other even somatic-based therapies, etc. Okay, so attachment trauma. So as kids, we have these attachment styles, and I'll just go over the two basic ones today: avoidant and anxious attacher. So depending on how your parents raised you, you bonded with them healthily, that's secure attacher, or you may have had your needs ignored. You may have felt extreme fear and abandonment issues. So sometimes what can happen as adults is you potentially go through a breakup, or you stay in an unhealthy relationship because you have these abandonment issues, and those abandonment issues can be tracked back to some type of trauma to the child. And a lot of that separation anxiety can be caused by that. I was working with a client who was dating someone who lived in her area, but he traveled for work during the week, and she would have these extreme bouts of insecurity, abandonment issues, the fight or flight mind, can't concentrate, can't sleep unless you would hear from him. And we tracked that back to her father and the way that she grew up in her childhood, where her father was kind of one of those dads. He was an alcoholic, and sometimes he would show up, sometimes he wouldn't show up. And there was always this threat that dad was just not going to come home one day. So, but to that little child, that little girl, that was traumatic. And it had an influence on her relationships now. And so that attachment trauma, if you think that might be something for you, I would highly recommend you check out a book called Attached. And it's by two authors, but one of them is Amir, A-M-I-R, Levine. And it's a great book, and it has a quiz in there. Now, given a diagnosis of cancer is traumatic, hands down. We're going to talk about cancer on this screen. And my best friend and my mentor, Lori Miller, out in California, who was my hypnotherapy mentor, she got diagnosed with brain cancer. And the oncologist, they sat there for several hours in that first, consultation with the diagnosis. And she asked him, is there anything I can do? And I was shocked pleasantly, but he said to her, explore the emotional reasons you got cancer. And that's probably a hot topic for a lot of people, but if you really dig into it, the consensus now is that there is a contributing factor of emotions. related to cancer. And the idea is this, that it's not just one upsetting event, although it could be, but it's typically where you have stressful emotions at a certain threshold over time. Okay, so it would be, and Dr. Chong, who is a doctor that I've studied with out of Canada, who's also a clinical hypnotherapist, Dr. What was her name? I'll think of it in a second. She writes for, you can read the Hay House authors. So the former nun, Carolyn May, she wrote a book, Why People Don't Heal and How They Can. And she talks about trauma. And then there's, quite a few doctors, not just recently, but years ago, talking about psychoneuroimmunology, how the brain affects our immune system, how our emotions affect our immune system. So we don't have to worry if we have some upsetting event that all of a sudden we're going to get cancer, but they do oftentimes track cancer back to a divorce, bankruptcy, something like that. And again, it doesn't mean that when you go through those things, you're going to end up with cancer. But what it does mean is that if you do go through those things, is that it's important to attend to your emotional fitness, your emotional health with that. And I have been on the board for an organization for about 10 years called Send Me on Vacation. And they send women who've been through breast cancer on trips. And I can tell you firsthand, this is a little diagram of everything that's tied into a cancer journey, the emotions that you go through with the diagnosis. And then as you're going through treatment, anger, denial, fear, shock, etc., anxiety, sadness, even after it's over, the fear of recurrence. It's an emotional journey, to be sure. And I would highly recommend that anyone who knows anyone, or you yourself, if you've been through cancer, that if you're in a place where you have the time to work through any residual emotions with that, that can be very helpful. Okay, so aftermath of trauma. So it could be months, years that you're past this, and you can have this, what I call low-level fight or flight. And that could mean, again, that scanning mind, the ADD mind that causes difficulty concentrating. It can cause you to overreact, which is a subjective term, I know, but if you feel like your response to something is overboard for the situation, it's not that necessarily that you're weak or too sensitive. It just could be a flag, an indicator that there may be something that you need to heal on that mind-body level to in the aftermath of trauma. So what is the subconscious mind's role in healing? The subconscious will oftentimes, right after the event, or even for years after the event, replay traumatic memories. Why? Why does it do that? It doesn't want to torture you. It's not doing it for a malevolent reason. It's typically replaying that trauma to heal it. And there was research that came from working with active military personnel coming back from active war situations and experiencing trauma. And what that research showed, and I was pleasantly surprised to read it, because it validated what I've been doing in the hypnosis room for decades. And I found this, this article about 10 years ago. So I was 20 years into my practice. But what they discovered is that it's not what happens to you that matters. And this is a really important point for everyone listening. It's not what happens to you that matters. It's the way that your mind how I describe it, now rests on that memory, or now thinks about that memory, or now talks about that memory. So what they discovered with the research, what they were doing is using some sort of medication, sedating the military personnel, taking them back to the memory and doing basically like cognitive reframing. So discharging the emotion, perhaps that's something we always do in hypnotherapy, using some NLP to clear the energy of the emotion that's still kind of locked in your body. Somatic therapy is really good for that as well. And then shifting that memory, a different takeaway, maybe stripping away feelings of guilt or helplessness or powerlessness or whatever it was, so that when your mind goes back to that memory, you can think of it differently, look at it differently, talk about it differently, so it doesn't have the same effect on you. Just one second. And so how I describe that is, we're not going to do, in hypnotherapy, we don't do years and years of going back to a memory or, repeatedly. You go to the memory, you identify why it's stuck in your mind. There's a good intention with that. Usually there's a takeaway, a belief, or something that needs to be healed. And then once that's done, I call it putting it on the shelf. And it's not that you don't remember it anymore with hypnosis, but you're able to just discharge the emotion, get the lesson, get the insight, put it on the shelf. And then what the research with the military personnel says is that's the neuroplasticity, is that your brain, what the research shows is that your brain keys off of, your body responds based on the last way you thought about the memory, not what actually happened. Does that make sense? So it's not what actually happened that would keep putting somebody into fight or flight. It's once you can go to that memory and have a different perspective on it. Oh, last time I thought about that memory, I was in the therapy office and we were looking at the lessons, or we were looking at this or whatever. We were firing my dad off to good parenting school or something. Then your brain and your body, your physiology will key off of that last time of the memory, not what actually happened. And that's, amazing to me and so powerful, and probably part of our survival mechanism. But sometimes people just get stuck in the loop with it. So seeking that understanding, some people have memories in life where you feel guilty or you feel ashamed. Something happened that you regret, and that the mind will replay. So the mind replays the memory to avoid future pain. The mind will replay the memory to make sense of it. The mind will replay the memory to somehow make peace with it. The mind will replay the memory to punish you for doing something that wasn't in alignment with your values. It always has a good intention, but the thing is that replaying it over and over again will wreak havoc on your adrenals, your body, and it can't continue to happen. You've got to find a way to process that emotion and move on from it, even if you feel like you were at fault. Okay, so tips for self-care. Immediately after, rest, relax. I was working with somebody after the fire, and again, even though he wasn't directly in the fire, and his house didn't burn down or anything, it was so traumatic with the looting and everything that was going on that his brain just didn't reset itself within the next 2 days. Completely understandable. And here he was trying to get back to work again. And so when you've had these traumatic events, give yourself maybe extra time off, extra time to do something that's relaxing to you, and be kind to yourself if you're not able to focus like you normally would. Take care of your body, do exercise if that feels good to you. You could do hypnosis. limit exposure to triggers. So that means, if that trauma was happening in a certain place, maybe you don't go to that place for a bit. Connecting, of course, with loved ones, therapists, friends. Now, if it's happened to someone you know, listening without judging, of course, we know that. Offering assistance. How can I help? What can I do for you? Encouraging them to get some professional help would be outstanding. Everyone has their own way of processing grief, especially with loved ones. Some people want to write about it. I know I wrote a story about my dog passing away and what it taught me about love and life, and that was very healing for me. And I posted it in my email and my newsletter, and it felt like that was something that really helped me. And I've seen a lot of people that have gone through grief, loss of a partner, doing this, and it's really about them expressing and, so being patient and understanding with people. Sometimes just giving someone a hug. I know it's awkward and people don't know what to say and do when someone has lost a loved one or had a tragedy. And that's why I'm a big believer in saying, how can I help? Okay, so here's some training that I learned about from a hypnotherapist who was on a volunteer team in San Diego to show up. They had this really amazing, kind of unusual volunteer team that would show up at the scene of a car accident, a fire, any kind of tragedy, but the people would show up to be with the collateral damage, the people who survived it. And then she taught us that the first thing that they say when they go on scene is, I am here to be with you. My name's Rebecca and I'm here to be with you. Or if it's someone hey, honey, I heard what happened. I'm here to be with you. And what that does is, the idea is that it brings the person into the present, because again, when you've had the trauma, your brain is just spin cycling into what just happened, and they're dissociating. Perhaps they're not here, they're not present, but you say, I'm here to be with you. And that's straight from an emergency responder technique. If it's you, this is something I've used for years, and I put it right into people's hypnosis recordings, again, months, years after an event where they are still having chronic anxiety. They feel like they're skittish. They jump too much. They don't feel safe for some reason. Is you put it right into your own words. And it's a way to bring yourself back to your current surrounding. And it sounds bizarre because your logical mind says, I know exactly where I am, but I am telling you, the subconscious sometimes doesn't get the update. And so to say to yourself this simple phrase, I'm not kidding, if you did this 3 times a day, when you go to bed at night, for sure, when you wake up in the morning, just anchor yourself into where you are right then, and you say, I am safe, I am safe, I am safe. It kind of wakes up your brain to know that you're not still in that fight or flight situation. I am safe, I am safe. You could say that to someone. I'm here to be with you. You're safe. I'm here to be with you. You could do that as well. Then the other thing I said, people say, oh, well, just go home and take a bath, or, just go do this, go do that. I think it's best to just say, hi, I know you've just been through this, or I'm sorry for your loss. How can I help? And a lot of times people are going to say, oh, thanks, but there's nothing you can do. But sometimes just by you saying, how can I help, they will think of the thing that they need in that moment. And that's, to me, much more effective. It shows you care, but you're not assuming what they need. So And we're almost done here. So as far as beyond those initial things, I'm safe, I'm here to be with you, you are safe, how can I help? Just be those like little initial things. Cognitive reframing. You can get this through cognitive behavioral therapy. We do a version of it in clinical hypnotherapy, but it's a method that I was talking about earlier where it focuses on shifting your mindset in order to change how you interpret a situation, experience, a memory. Essentially, you're going to change it's not that you're erasing the memory, but you're just kind of a different takeaway from it that allows you to discharge that emotional response that's locked into your body with the memory and causing the fight or flight symptoms to persist, whether it's anger, ADD symptoms, etc. So with a lot of people, I want to say that clinical hypnotherapy is really powerful in conjunction with traditional therapy. Over the years, I've had quite a few wonderful psychologists, licensed counselors, and therapists that refer to me, and I will help people recover memories, go back to childhood memories, and then they go back to their therapist and continue processing it, getting those insights, etc. So you could look at hypnotherapy and psychotherapy or somatic therapy, which is all about, doing movements for the body. You could look at all these things, even Reiki for energy healing, whatever it is. But for many people, the ideal healing journey is a holistic approach, a complementary approach where you're adding different modalities to help yourself or help someone else move forward. So that would be something I would recommend as well. And if someone has a diagnosis of depression or anxiety, then I do require that they're also concurrently working with somebody. And depending on the situation, I almost always, if it's something pretty severe, I want to make sure that you have all the support that you need and that you're working with a therapist. So we kind of discern that in a one-to-one conversation, but it's nice to have lots of different levels of support. Okay, so I'm going to go to the chat right here. Okay, so John, you said I've been doing a lot of stuff like that for my own body recently. Yes. Anthony, can you give an example why someone might be avoidant? Yes, great question. Okay, so someone can be avoidant for many reasons. And one can be that when you were a child, you may have asked for your needs to get met. You may have cried and not had a parent attend to you crying. You could have been upset or sad, and that parent ignored your emotions. You could have felt that if you cried or you were upset, you got in trouble for it, you got spanked for it. So then that type of child will develop this belief that you avoid your own emotions, and you may feel uncomfortable with other people's emotions because your emotions were not attended to as a child. Sadly and unfortunately, because I think that's a crime, honestly. I think our society, we need to teach our kids emotional fitness. So then you adapt to become avoidant of your own emotions. And now fast forward in relationships, I've seen a pattern where people will feel smothered in a healthy relationship, meaning someone who grew up with, it could be just on the surface, like the Beaver Cleaver family. But if that boy, I'm thinking of a story I know where that boy was told to suck it up, toughen up, don't cry. And he was actually a sensitive kid. So then he goes on to be an adult, and his new girlfriend doesn't hear from him all day and says, I was really worried about you. I thought something had happened to you. You're normally responsive. And he kind of, well, he was dismissive of her. And it wasn't that she had done anything wrong, but he wasn't used to that type of someone sharing their own emotions. And it felt maybe whiny to him, So I hope that if that doesn't answer your question, feel free to ask more. And it looks like, I don't know if anyone else has any other questions, but feel free to email me if this sparked something that I can direct you to a resource or have a conversation with you about maybe some symptom or some situation in your life that's keeping you from living optimally, feeling optimally, operating optimally. If you're interested in working with me or having a conversation, you can email me at RebeccaShawCCH@gmail.com. Go to CharlestonHypnosisCenter.com. And then if you're interested in training to work with people on their trauma, for example, you can go to my training website, ahca.pro. Yeah, Anthony, it is. It's really interesting, and it does explain a lot about relationships. Thanks for bringing that up. I think it might be sparking an idea for a whole new presentation just on that type of topic, because it is so important. We want more people to love and be happy in their relationships, and that kind of stuff can really be at the subconscious level influencing people's dynamics with each other. So, great. Well, again, if you guys have any questions, I hope this was helpful. And my last note would be, you are not stuck with anything. I do not believe that. I went into this work because I was told I was stuck with depression. I'd have to take medication for the rest of my life. And that was in my early 20s. And I found hypnotherapy, and it was so radically healing for me. And I've helped so many people with different levels of trauma that if I can help you, please reach out or talk to your therapist about it. But do not ever believe you're stuck with anything. My love to all of you. Take care.